Welcome back. In just a few short days, the COVID-19 pandemic has just changed the way that we live our lives and interact with each other. The fear of the virus can really affect our mental health.
Yes.
And to talk about that right now is 9 Health expert Dr. Pyle Coley. Good morning.
Good morning.
Nice to see you again.
Yes, you too.
So on my social media feeds, people are talking about being stressed out, anxious. It's really that fear of the unknown, what this virus could do. People are panic buying. So what are some of the effects of mental health that you've seen so far?
So I think you pointed out to the biggest one, which is panic and fear. I want to start just by saying this is an unprecedented time and very challenging. If you just think about the last 10 days, the way we live our lives has changed, the way we interact with each other, and our economy. So all of those are sources of stress. But some people are also turning to things like substance abuse. Alcohol use is increased during this time. Your sleep is disrupted. And some people feel anger. Others can feel socially isolated because we're advocating social distancing.
Exactly.
And loneliness is a big thing. So there's many different manifestations of mental health problems that can occur.
Who is most susceptible here?
So we all are, actually, and it's a normal response, but the most susceptible are the same that are the most susceptible to the virus. So the elderly and those with chronic problems, because they're the highest risk. So they have to socially isolate even more, and they're already at risk for being lonely. Kids and teenagers are another vulnerable population because they may not understand why we're doing what we're doing. Healthcare workers who are on the front lines, and those with prior mental health problems as well.
You bring up this concept of emotional contagion.
Yes.
What does that mean?
Emotional contagion is something that evolved in our brains, which means our emotions are contagious. So if I started laughing, you would feel like laughing, or if I ran for panic, you would as well. And I think that's really propagating some of the fear and panic, is that emotional contagion. So one person's panic response can trigger that in somebody else. But we can turn that around and turn it into something positive, like community togetherness or empowerment. And that's contagious too. The positive emotions are contagious just as much as the negative ones.
That's so right. I mean, people buying water bottles when the water supply is not going to change at your
Expected to be interrupted,
Right, and then that just leads someone else to think like, oh, why are they buying water bottles? Maybe I should too. And that hysteria and panic are just contagious in that way.
Spreading faster than the virus, actually.
That's so true. So what can people do to cope? We'll talk solutions.
So it's hard because at this time, all the things that we normally use to cope, such as church and calling a friend and meeting them for dinner, are actually off the table. But I think it's really important to pick one or two things, and I would recommend meditation and mindfulness every day. I personally have been journaling one positive thing every single day.
That's great.
Yeah, because the more you hear about the pandemic, the more the panic and the fear rises. As you said, uncertainty, doom, economies going all over the place, people's 401k. So I write down one positive thing like community togetherness or awareness of my health every single day. And then I also think it's important to continue to connect with family and friends, do it virtually, obviously, through the phone or FaceTime. And then it's important to get outside and take walks. So just because we're socially distancing doesn't mean we need to stop exercising and doing things like that. Just make sure you maintain distance when you go out.
Yeah, I love the fact that you journal.
Yeah.
That's so smart.
Yeah, it's been working.
Yeah, and it kind of puts you in that frame of mind to think positively and to really dig deep and look for what you're grateful for.
Exactly.
Dr. Coley, thank you so much.